World AIDS Day today. The infection rate is set to be on the increase in the country. Let's cross over to Xikundu in Limpopo, where our reporter Lutendo Bobodi and video journalist Hulisani Ravele are on standby now to give us an update as to what is happening there. Good morning, Lutendo. Give us an update. How are things going there?
Thank you so much. As we said earlier, the Deputy President, David Mabuza, is here in the area in Xikundu. Earlier, he's been visiting with the royal family just to say hello as a procedure. And he's expected to be here in just a few, probably in the next hour. He also has to do some sort of house-to-house, trying to drum up the message concerning HIV/AIDS and also COVID-19. And of course, we're still waiting. We hear that things will start around 12 o'clock. There's been some delays, as we said earlier. The people are still, there's some people who are still putting up a tent, some sort of a marquee for people to sit in for this event to move on smoothly. Earlier, we spoke about challenges that the country is facing in terms of the fight against HIV/AIDS, and one of those challenges is, of course, reaching the 15 to 24 group, that is young people living with HIV/AIDS. Many of those are now attending school in primary, in secondary mostly, and from what we hear from health authorities, from NPOs, from home-based organizations, is that there's been some sort of a challenge reaching them now, because there's some sort of a rule that has been introduced in schools, to try and prevent people to visit schools. That includes those who go out and teach these young people about behavioral change, how to treat of course, HIV and AIDS, and of course the information itself about the HIV/AIDS. And of course, we hear that people are being prevented to come in, and that is a challenge. You remember that the UNAIDS has scaled up targets in terms of seeing people living with HIV having a low viral load, and of course children are also included in that. But to talk more on that, I'm joined by Nelson Dlamini from SANEC, South African National AIDS Council, who joins me now. Thank you so much for your time, Mr. Dlamini. Talk to us about the challenges that is being faced by the country, South Africa, in trying to reach young people living with HIV/AIDS.
Thank you, and good morning to your viewers. So when you look at that cohort of young people between the ages of 15 and 24, specifically young women and girls within that age group, they are the hardest hit in terms of new HIV infections. We record about 1,300 new infections per week, just within girls alone. And when you look at the boys of the same age, the figure is 3 times less that. This then means that we really need to scale up our interventions targeting young people. We need to design programs that are geared towards young people, driven by young people. And I think the introduction of policies such as the comprehensive sexuality education that is driven by the Department of Basic Education is one of the useful tools that can help us reach young people. I mean, when you look at the recent stats of teenage pregnancy, children as young as 10 years old giving birth, it raises a concern. And it also means that there's a large number of young people that are having unprotected sex. And generally, when you look at the statistics of condom use, that has been dropping steadily over the years. And it remains a concern to us, because it then means if people out there aren't using prevention commodities, such as a simple thing like a condom, which is very accessible, it then means there's a huge concern out there, because it means HIV it may be continuing to spread, STIs may be continuing to spread. So we do need to really scale up our efforts for young people.
Okay. Another challenge is non-disclosure. when one spouse tests positive and they don't disclose to their spouse. How's that? How are you dealing with it?
So it is criminal. Firstly, we must put that out there outright. It is criminal for somebody to knowingly have unprotected sex with the next person when they know that they are HIV positive. Obviously, disclosure is a sensitive issue, and that needs to be handled with care. But we do encourage that people disclose to their intimate partners, because there's actually no need to be afraid of this, because if you are taking your treatment and you are adherent, you can actually enjoy a healthy relationship where even protection such as a condom can be left aside, obviously with guidance from a medical practitioner, because the positive partner has to be negative, and so that if they have sex, then there are less chances of passing the virus. They can conceive, and we have a lot of we call them discordant couples, where one is positive, one is negative, who are enjoying a healthy relationship where normal practices between a couple can happen. So there is no need. It's just a matter of getting over that stigma that you may anticipate, and then just being open with your partner. But it is not right to knowingly engage in unprotected sexual activity with your partner.
Thank you so much. Yeah, that was Mr. Nelson Zamini talking about the challenges, of course, that the HIV program in South Africa is facing. Of course, it's a confluence of challenges, and of course, it starts with the people themselves. Government may have programs to deal with this, but it starts with the people themselves.
Lutendo, thanks very, very much. And important story I know that you'll be following all day. And of course, that's our SABC reporter, Lutendo Bobodi, and video journalist, Hulisani Ravele.